Finally, I would like to introduce to you today Tracy. Tracy is a patient who's going to be having an interview with us today live on this webinar. And this is a picture when her baby was 1 year old. And Tracy's body mass index at that time was 43. She had her gastric bypass in June 2013. And her complications from obesity were sleep apnea on CPAP, reflux, exercise intolerance, migraine, and joint pains. And we will share her experience where a lot of these comorbidities have either improved or gone away. Therefore, I would like to introduce you to Tracy. And this is Dana Jones, advanced registered nurse practitioner, ARNP. And she's the Bariatric clinical coordinator of the program.
Hello. So Tracy, I know you came to us a couple of years ago and just kind of talking about some of the things that you were experiencing that kind of brought you into us initially. What would you say was really the big push for you?
Well, I started having some health issues. I had to start wearing a CPAP to sleep. My blood pressure started creeping up a little bit. It wasn't out of the norm yet, but it was higher than what it should have been for me or what my normal was. I wasn't able to exercise or do a lot of things, that I should be able to do. I would be gasping for air. I kept trying, different diets, crash diets, diet pills, all kinds of things. Nothing ever worked. You don't teach yourself new habits. You just do things that put a Band-Aid on it and fix it for a little while. I was sitting outside one day and my granddaughter was playing outside and she took off toward the road. And I about didn't make it to her. She about made it into the road and there was a car coming. And I wouldn't have been able to live with myself if something had happened to her. So that was what made me decide I had to do something. I wasn't healthy. I wasn't healthy for my family. I didn't want to go anywhere. I didn't want to do anything. Didn't want to meet people. I mean, between my husband and I, we have 6 kids and 4 grandkids. They needed grandma and mom to be able to do things with them, and I couldn't do that in the state that I was in. So I realized it was time for change.
Yeah. And you said you made the appointment the next day, didn't you?
Next day.
Yeah.
So back in 2013, your weight was 234 pounds with a body mass index of 43. And today your weight is 123 pounds and your body mass index is 22. So 22 is within the normal range. The normal range is 19 to 25. 22 is right in the middle. And you've lost more than 100 pounds. Tell us how that has impacted your life and activity.
I pretty much got my life back. I can be in activities now. I can run with my grandkids. I like going out and meeting people now. We like to go out and dance. We ride motorcycle. I'm not secluded anymore. I don't mind going to the mall or, we go to the pool now. We take the kids swimming. It's all stuff that I would have never done before. It's actually exciting to me now. It's like I'm learning all these things all over again and learning to do new things. I have a whole new life.
You said you kind of, before surgery, something that kind of caught me, we were talking before, and one thing that kind of caught my attention that you had said was that you always just tried to stay out of the way. And I think that that's an important thing for people to hear, staying out of the way, staying out of the picture. It's often difficult for us to find even a picture of our patients before they've had surgery because they're staying out of the way.
The picture that we showed earlier of myself years ago, the only reason we had those pictures, we did generation pictures, and when you guys called and asked for a picture, that's all I could find. I was always the one volunteering to take the pictures so I didn't have to be in it or hiding in the background hoping they'd forget about me, because you don't feel like you want to be in a picture, so it's very difficult.
So in terms of the complications you had before the surgery, it was on a previous slide. The sleep apnea, you were on CPAP.
Yes.
Did you come off CPAP?
Yes, 6 months after surgery, I quit using my CPAP.
6 months, great. And the reflux?
I have not had any reflux since surgery.
Okay, so soon after surgery, the reflux went away.
Yep.
Okay. And the exercise intolerance?
Like I said, I'm able to participate. I can run. I can ride bike. I can do lots of things I couldn't do before.
So you can run now, and you could not run before.
Yes.
And you were not biking before, but
No.
now you can bike.
Nope.
And then the migraine headaches.
They're gone.
That's very interesting because we have one of the first publications in the literature where gastric bypass has an impact on migraine headache. And people wondered how migraine is impacted by weight reduction. And in our paper, we discuss how the fat cells produce certain molecules called cytokines. And the cytokines are inflammatory molecules. So when you have increased weight with more adipose tissue, you have more cytokines in the entire body. And that somehow affects the brain to cause migraine symptoms. And therefore, with surgical weight reduction, we've shown that the migraines go away. The paper that we've published has impressive data on that. And I think you're a living example of that. And then finally, the joint pains. I presume the joint pains have gone away because now you're running and biking.
Yes.
Yeah.
So one of the other things that you said earlier when we were talking, you kind of talked about support systems. And I know we stress a lot that we have good support systems for our patients. Tell me a little bit about how your support system was before surgery.
Outside of the hospital, I was real worried. You know, you get feedback from a lot of different people. They all have different opinions. So I talked to my husband about surgery. He was very supportive, and I chose not to tell anybody else. And I came to Iowa City, and I met with your staff here. I spoke with a dietitian, a lot of nurses, Dr. Samuel. They have a very good support system. They taught me all the information I needed. It wasn't just like a crash diet. You come down and they actually teach you how to change. And you know, a lot of people think that this is a really easy procedure. This is kind of a cop-out. Oh, well, you cheated. The easiest part of this whole situation has been the surgery itself. You have to teach yourself to change, to be different. You have to eat different. You have to, you know, portion sizes, when to eat what kind of food. And the staff here did an awesome job teaching me how to do that. I started losing weight after my first appointment. I started doing my charts and everything, watching what I ate. And, you know, I share this with as many people as I can now when they ask me, well, how do I lose weight? And I mean, even if they're not having lap band surgery, the stuff I've learned would help them. You know, it will help them lose weight also. So it was an awesome support group down here.
Good.
So.
But you need to know that you did it, and you did an amazing
I had
job.
help.
So Tracy, thank you so much for joining us today and sharing your life experience with us on this live webinar. You've come all the way from Independence, Iowa, which is so far away from here. So thank you for making the journey here to meet us and share your time with us. And 3 years after surgery, you've gone without any bypass-related complication, and your life has changed dramatically. Thank you so much.
Thank you.